My research focuses on pain, particularly chronic pain. Things like headache, migraine, arthritis, low back pain. These conditions are very common and are seen by medical specialists in almost every discipline. And yet we know very little about them, and our ability to treat them is weak, because in most medical disciplines these conditions are considered as symptoms of one disease or another, and the physicians are trying to cure the disease rather than concern themselves with the symptoms. This attitude has changed over the last years, and it's become more and more clear that it's important to see pain not just as a symptom but as a biomedical problem in its own right. Our work focuses in particular on neuropathic pain, which is a particular kind of pain associated with injury or disease of peripheral nerves. One of the most famous examples is the fact that amputees continue to feel their missing limb as if it were still present, and often feel severe pain in the missing limb. We have contributed a theory which says that the problem with neuropathic pain, the reason for neuropathic pain, is a misconception on what nerves are. One often thinks about nerves as if they're sort of copper telephone wires. When you cut the telephone wire across, then the line goes silent, and one would expect that if you cut a nerve that the limb would simply become numb. But in fact, the nerve that's been injured is not a copper wire, it's an extension of many live nerve cells. And these nerve cells act or respond actively to the injury. They begin to become electrically hyperexcitable. They generate abnormal electrical impulses which run up the nerve into the spinal cord and into the brain, and there they're interpreted as chronic severe pain. If this theory is correct, and we can use it to develop new treatment modalities, and particularly new drugs which will suppress abnormal firing of injured nerves and stop the pain, this could have fantastic implications, improvement of the quality of life of millions of people who are currently suffering from chronic neuropathic pain.